Hello, everyone. I am Dr. Garima Sharma. I am doing DNB Pediatrics from Popular Hospital, Varanasi. And today I'm going to speak about hand, foot, mouth disease. It is a very common phenomena which is seen in 5 years old children or less than 5 years old children. Can we start with the presentation? Okay, so let's start. So what is hand, foot, mouth disease? So it is a very common phenomena. It is caused by virus. It is a viral illness which occurs in children who are less than 5 years old. And usually the viruses are Coxsackie virus or enterovirus, which is a very common mode of spread. And it usually spreads by direct contact in an affected patient or an infected mother. Next. Next. So this is a pictorial presentation. Now, what can you see in the baby? There are sores on the tongue. So baby will be very toxic. The baby will look very irritable. So can you see in this, the baby is very irritable. He will have sore throat or fever, loss of appetite, irritability in infants and toddlers, and there will be red rashes which will be present in hand, feet, and mouth. And child will have symptoms of low grade fever. He will be very irritable. Feeling of unwellness will be there. Next. So, like, how do we say that the child has hand, foot, mouth disease? How do we prove that this is a case of hand, foot, mouth disease? So, the child will have a mouth tongue ulcer or a maculopapular rash, which is going to be present over palms and soles. It can happen with or without fever. Suspected hand, foot, mouth disease is in which these three criteria will get fulfilled: mouth tongue ulcer, rash, or vesicles over palms and soles, or fever, which fever is not mandatory that it will be present in every baby, but yes, it can or it cannot happen. Next. So this is a pictorial presentation where you can see the vesicular rashes which are present over hand, feet, and mouth. Now remember, these rashes are very painful, which are present over the tongue. Child will not be able to take feeds properly, or child will not be able to eat properly. So we have to take measures properly. How to even treat these? Next. So how does it spread? It is a very contagious disease. It can spread. It is usually found in infected person's nose, throat secretions such as saliva, sputum, nasal mucus. The blisters which are found in hand, feet, and mouth the fluid which leaks from the blisters can also be the mode of spread. Even the feces which baby passes is the mode of spread. Now, usually it is the most contagious during the first week of illness. People can be contagious even after the symptoms go away. Next, complications. Now, usually it is a very mild disease. It can be treated at home, but sometimes it can take a major course. Sometimes it can lead to viral aseptic meningitis. What is viral aseptic meningitis? Brain fever. Usually it happens, it does not usually happens, but when it can get complicated, it can lead to viral aseptic meningitis. Sometimes what happens is these fingernails or toenails can get uh, there can be a loss of fingernails or toenails, and usually it is reported within 1 month. So we don't have to worry much about it. Next. How can we control this infection as it is a very contagious disease? I want everyone to understand it is a preventable disease, and by small precautions we can make changes. So how do we control this infection? We can do it by hand washing. we should maintain proper hygiene, including mandatory hand washing after contact with patient, appropriate cleaning with diapers. What we do is we change the diaper and we forget hand washing. We are supposed to change the diaper because usually feces are also very infective, and with the help with this mode of spread, infection can happen. Personal items such as spoons, cups, utensils should not be shared. We should make a measure that we should keep the baby's utensils aside. We should not mix the utensils. So keeping personal items such as spoons, cups, utensils should be properly washed with detergents. In fact, we should take precautions while sterilization. We should boil the utensils, like the nipple, and the nipple should be changed every week. It is very important. And if we are keeping the child in the hospital, sometimes it can take a severe or a dangerous course. If we are keeping the child in the hospital, we can wear gowns to the people in the hospital should wear gowns because it can spread. It is very contagious. And also what we can do is the toys, which the babies are fond of toys, all we know. And now what we can do is we can clean the toys with sodium hypochlorite solution, and a proper method of diaper disposal should be made. We should not throw away the diapers here and there. We should always make sure that we throw diapers properly in a black dustbin. Next. Now, I'll give you a scenario, and now we have to assess. Now, what happens? There's a 4-year-old sweet baby boy who is studying in nursery, goes to swimming daily. He comes after his swimming classes and he develops mild grade fever since one day, and he develops a rash, a painful rash since 2 days, and a baby is not able to take oral feeds properly. Now, what to do in such scenarios? Next. Now, here's the pictorial representation. That baby boy is coming with rashes over the mouth. Next. So basically, we have to understand one thing, that whenever, as parents, whenever we see any rashes, we get very worried. What is this? Now, what are we supposed to do? First of all, don't panic. Please don't panic. Now, there's no specific treatment for hand, foot, mouth disease, but some things which we can do is take the medications for pain. Just we have to treat it symptomatically. Why? Because it is not a bacterial infection, but it is a viral infection. So we are supposed to take some antipyretics. We can take some antipyretics for fever and some painkillers. We can use some painkiller mouthwashes or sprays, which can help in reducing the pain over the mouth. Next. So now this has been done. Now, when are we supposed to worry? When we should think that our child is not getting fine and we should take him to a bigger center, we should take him to the hospital, is when a child is having a high grade fever, fever of 100 degrees for more than 2 days, और हमें बच्चा सुस्त लग रहा है. अगर हमें बच्चा सुस्त लग रहा है, या बच्चा जल्दी से उठ नहीं पा रहा है, या बच्चा खा नहीं पा रहा है, बच्चा अच्छे से यूरिन पास नहीं कर रहा है, तेज सांसें खींच रहा है, उल्टी कर दे रहा है, कुछ खा नहीं पा रहा है, चिड़चिड़ापन या फिर झटके उसको आ रहे हैं, तब हमें चौकन्ना होना है. चौकन्ना होना है, हमें बच्चे को भर्ती कराना है, बच्चे को हॉस्पिटल लेके जाना है. ये याद रखें, इसकी कोई वैक्सीन नहीं है. ठीक है, इसका कोई वैक्सीन नहीं है. लेकिन जब भी ऐसा कभी भी हो, जरूरी नहीं कि सिर्फ इसी बीमारी में, लेकिन अगर कोई भी बीमारी में अगर आपके बच्चे में ये सारे लक्षण आपको दिखें, तो आप प्लीज अपने बच्चे को हॉस्पिटल लेके जाएं. नेक्स्ट. हम इससे बचे कैसे? हाउ डू वी प्रोटेक्ट आवरसेल्व्स? So a person can lower their risk of infection by washing hands. Now, COVID has taught us about how important is to wash hands after every exposure we do. Washing hands with soap and water is minimum you can do. Wash your hands with soap and water, especially after changing diapers or using the toilet. Cleaning and disinfecting frequently with touched surface and soiled items. What are soiled items? Is feces, diaper, इंक्लूडिंग टॉयज. हमें ऐसा लगता है कि हमने ये छू लिया या खिलौना को छू लिया तो कुछ नहीं हुआ. बच्चा खिलौने को मुंह में भी लेता है, हाथ में लेता है. हमें ध्यान रखना है कि बच्चे का इन्फेक्शन दूसरी जगह हम ना फैलाएं. तो क्लीनिंग एंड डिसइंफेक्टिंग फ्रीक्वेंटली टच्ड surfaces and soiled items including toys. Avoiding close contact, which is very difficult with the kids, I understand. Avoiding close contact with such as kissing, hugging, sharing. We have to stop all this. We have to treat I know it is difficult with babies, but we have to make sure that we should avoid close contact such as kissing, hugging, sharing, and eating in the same utensils or cups with people with hand, foot, and mouth disease. If a person has mouth sores, it might be very painful for the child to swallow. Of course, if you have mouth ulcers, आपके मुंह में छाले हैं और आपको कोई बोले कि खाना खाया जाए या दूध पिया जाए तो हमसे ही नहीं हो पाएगा. लेकिन अगर छोटा बच्चा है तो उसके लिए तो और भी मुश्किल है. बट हम अपने बच्चे को ऐसे नहीं छोड़ सकते. तो वी हैव टू मेक श्योर दैट आवर बेबी इज हाइड्रेटेड ऑलवेज. सो अगर बच्चे का दर्द स्प्रे से भी कम नहीं हो रहा, माउथ वॉश से भी कम नहीं हो रहा है, या फिर एनाल्जेसिक्स पेन किलर से भी कम नहीं हो रहा है, और बच्चा कुछ खा नहीं रहा है, अगर बच्चा कुछ खाएगा नहीं तो बच्चा वापस सुस्त हो जाएगा और हम ये नहीं चाहते. इसीलिए हम बच्चे को हॉस्पिटल लेके जाएंगे ताकि उसके पोषण में कोई कमी ना रहे. इसीलिए हम उसको पोषण देंगे और पोषण अच्छे से हॉस्पिटल में ही दिया जा सकता है वाया IV फ्लूइड्स. हम लोग उसको सुई से पोषण देंगे. नेक्स्ट. If the outbreak occurs in primary schools, now this is a very important slide for all the students, teachers, doctors, what we should do, what as principals, teachers and supervisors, because हमारे बच्चों की हेल्थ ज्यादातर स्कूल वालों के पास रहती है. जब स्कूल में हमारा बच्चा जाता है तो उसके लिए हम क्या कर सकते हैं? Principals, teachers, supervisors, headmasters should be alerted to look out for children with fever, with rash, blisters on palms, soles. हमें उन बच्चों को आइसोलेट करना है. हम लोगों को हर बच्चे को क्लास में जाने से पहले देखना है कि बच्चे को कोई फीवर या कोई रैश या बच्चा सुस्त तो नहीं है, जो कि हम अक्सर ध्यान नहीं देते, लेकिन हमें छोटे बच्चों का ध्यान रखना है. Ensure that the infected children remain away from the institution for at least 10 days after the onset of symptoms and must be certified free from the infection by a registered medical practitioner prior to returning to school. You need 10 days for isolation of the child. Health education to the students on the disease, mode of transmission, importance of good personal hygiene is very important. If closure is necessary, just close the affected class. Closure of whole school is not necessary like COVID. We don't have to do like that. We can do is closure of a class if like more than 5 kids or more than 6 kids are getting infected. So we can just close down the class. Closing down the school is not necessary because it is not a major illness. Next. So this is a small form we can do is where like all doctors should have this form where there's a small prescription, date, name, address, hospital. Now symptoms. Now, symptoms, can we see fever more than 38? That means 100 degrees. Yes or no? If yes, onset of fever, then we have to see loss of appetite, malaise, sore throat, rash, appearance of rash over palms, soles, knees, elbows, buttocks, genital area. So these are the sites where rashes are found, where palms, soles, knees, elbows, buttocks, genital area. We have to make sure if anyone else in the family or anyone else from the class has the same problem. Loss of appetite, sore throat, painful sores, rash. Okay, so area of rash, and what we can do is we can take a swab. This slide is basically for doctors, where previous slide. Yes. This slide is basically for doctors, where, what we're supposed to do in a case of hand, foot, mouth disease. How do we prove that this is hand, foot, mouth disease? By just a small, we can do a checklist. This is basically a checklist. And what we can do is we can take the sample from all samples except blood, serum, and stool must be in viral transport media, and immediately it should get going to microbiological laboratory. Next. So now we have to understand what is the criteria. This is very important, which I was saying, that we need admission in such cases. This is not specifically to hand, foot, mouth disease, but very commonly when we should worry in any disease, we should take the child to the hospital. Mouth ulcers, which are painful, and these mouth ulcers can lead to decrease in oral intake and ultimately leads to dehydration. अगर छाले ही मुंह में रहेंगे तो बच्चा खाना कैसे खाएगा, बच्चा दूध कैसे पिएगा? अगर इतना दिक्कत रहेगा तो हम इंतजार नहीं करेंगे, हम 2 दिन, मुश्किल से 1.5 दिन हम रुकेंगे। अगर बच्चा ठीक नहीं होगा, हम तुरंत उसको हॉस्पिटल लेके जाएंगे। क्यों? क्योंकि हमें हमारे बच्चे का पोषण देखना है। पोषण ही सबसे ज्यादा जरूरी है। अगर बच्चे का बुखार है, बच्चे का बुखार 100 से ज्यादा है 2 दिन तक, या फिर कुछ भी न्यूरोलॉजिकल कॉम्प्लिकेशंस है कि बच्चा सुस्त है, बच्चे को उठाने पे भी बच्चा नहीं उठ रहा है, या फिर घर में कोई है नहीं जो बच्चे का देखभाल ढंग से करे, तो हमें तुरंत बच्चे को हॉस्पिटल लेके जाना है। नेक्स्ट. These are 8 steps of hand washing, and I want everyone to repeat these steps of hand washing because it is mandatory. So how do we go about it? First, palm to palm, then between fingers, and time is very important. At least 5 times. 5 times this, between the fingers, back of the hands, base of the thumb, fingers, fingernails, wrist, and be rinse and wipe dry. And always keep the hands like this. But if you don't have a dryer, keep the hands like this after washing the hands so that the water drips down due to the gravity. Next. Thank you. This was about hand, foot, mouth disease. I am Dr. Garima Sharma from Popular Hospital, Varanasi. Thank you.